Welcome to the Been There, Lost Fat podcast, real education and advice from people who get it. We have been there, lost fat, and successfully helped many others in doing so. I'm Sarah Fuccinari, an integrative health practitioner, certified nutrition coach, and head coach of Team Fit With Me. Here with my partner in business and my partner in life, Mark. Also, we have an awesome guest today. I know a lot of people that are listening have had long conversations and great consultations with Lane. Welcome to the pod, Lane.
Hi.
So Lane is our in-house everything. She helps with so much stuff as far as anything that we need for extra support with labs, with education, advice, all of those things. And I'm so excited to have her on the pod today. Lane, why don't you introduce yourself and just tell us kind of like who you are, what you do, what your credentials are, all of those things, and then we'll take it from there.
Okay. Hi, guys. I'm Lane. For those of you who have not met me, I am a registered nurse. I am also a certified diabetes care and education specialist, which comes in handy when it comes to these GLP-1s that we're going to talk about today. And I am a mom. I am also working on my master's of nutrition. And the thing I'm working on right now, too, that I'm most excited about is becoming a certified menopause health coach, because there's such a great need for women to understand menopause and how to navigate it. And I was one of them. When I went through menopause at a very early age, I had fertility issues conceiving both of my daughters, had to use fertility drugs to conceive them. Then I went into menopause at a very early age, and it was rough. I am only in my mid-50s, and I've already had a hip replacement because of the damage that menopause does to our joints. So I'm excited. I'm excited to prevent those complications for you as a lady.
And I think a lot in what you do aligns with what I do as far as that it's usually not for a lack of trying, that a lot of times that it's a lack of education. And we know that on the nutrition front, there's so much bad information. But as far as your wheelhouse, my goodness, is there bad information?
Yeah. Yes, there is. There is. With medications, with disease management, with menopause, which is not a disease. I mean, let's clarify that right now. Menopause isn't a disease. It's a transition we go through in life. But we want to be able to navigate that transition. But there's so much misleading information out there. And it's just sad. It's really sad.
I'll tell you that I have learned a lot about menopause. I'm not quite there yet, but I've learned a lot within working with pre and post-menopausal women. And I'll tell you that they don't teach you anything. I have, and I'm not quite there yet, but because of you have and because of working with clients, have an idea of what's to come. But even more importantly, I have a great idea of how I can set myself up for success so that it's not such a scary transition. So, stay tuned. Everybody stick around for the next, 15 years or something like that.
Definitely.
I think something that's super relevant and that I'm gonna throw my hat in the ring on this too, is to hear about your health journey, kind of from start to now, and what led you to wanting to receive all this education and become so hungry for knowledge and teaching others. So if you could share a little bit about, well, not a little bit about, if you could share your entire story, your health story, that would be awesome.
Okay. So, my background is orthopedics and neurology, med-surg, worked for many years, hospital bedside. I loved wound care, which is kind of crazy, but I loved wounds. And so I actually started thinking about going wound journey and becoming a certified wound nurse when I went into home health. And as I was working in home health and I was taking care of amputations and non-healing wounds, major burns because people had lost feeling in their hands and their feet and didn't know they were getting burned and everything, I thought, okay, instead of becoming a wound nurse, I need to shift gears and become a diabetes educator and stop these things from happening. So kind of giving you that background, I just kind of tell you that the reason I go into these specialties is because I want to stop people from having the complications. I want to support people in their journey. So I've worked for many years now as a certified diabetes educator. I worked for a major hospital in downtown Atlanta doing all bedside nursing with the clients and everything. So, with patients before they went home from the hospital. So, long story short, I stopped having cycles 46, 47 ish. Prior to that, I would have wicked, wicked hormone headaches. And then I would start like within the next 24 to 48 hours. They were debilitating headaches. I didn't know what was going on. I started having dry mouth. I started having all kinds of issues happening with my body, and everything. And then boom, stopped having cycles and everything was okay for a minute. Then all of a sudden, I was sitting in a staff meeting one day. I started crying for no reason, like,
Oh no.
out of nowhere. And then I started having massive shot flashes, and I started having all these crazy things that were going on in my body. And I was like, oh my gosh, I'm in menopause. But I didn't know much about menopause. Like, I just really didn't know. Nobody talked about it. It wasn't something that we studied in nursing school. It wasn't something that doctors aren't even required to dig into it in medical school. So I did go to a gynecologist who was semi-retired, who all she did was menopause. And she taught me a lot. She actually slid across the desk one of the main studies from it and explained to me why the study was so debunked, and everything, and why the study has so many women terrified of HRT, which is hormone replacement therapy for those of you who don't know. So as much as she knew about menopause, she threw estradiol patches at me and progesterone at me, but never drew labs. Didn't go any further.
Lord.
She was just during menopause. So here, we're just going to treat your symptoms and everything. So I was like, okay, but I was like, don't we want to check the labs? Don't we want to make sure something else isn't going on? Like, don't we want to make sure that this isn't thyroid or something else or what and everything? But I started wearing those patches and taking that progesterone, and I was like a newborn. I was like, yay, really, yay! I'm not having hot flashes. There's so many. I'm feeling better. COVID hit. She retires. Was having a really hard time finding another doctor to just listen to me, to just treat me, to treat my symptoms, to guide me, and everything. So I just kind of gave up and everything. And I left the hospital setting during COVID. I decided it was time to get my hip replaced at that time and just go ahead and start my healing journey, because the menopause had done so much damage to the joint. And it's not always that it goes after the bone, but it starts messing with the ligament in those areas. And then it makes us start wearing and tearing that joint because we're not stable with that muscle loss, with that, and everything. So, got the hip fixed, started wanting to go back into hiking and backpacking and everything. And, I started having hot flashes again. Things started coming back because I had stopped taking everything because I just didn't have a good doctor to write prescriptions for me. So I found a great doctor who does the pellets. Round one of the pellets was amazing. It was life-changing and everything because they have testosterone in them and they had estradiol in them. And then you take the progesterone orally and everything. They last 3 months. Then you go back. They do your labs again, and then you do another round of them. So every 3 months, I'm paying cash for them because insurance won't cover them. And round 2 didn't do anything for me, nothing. And I was like, okay, this is crazy. I started working for Vivo. Realized I had access to these HRT, the ability to get the testosterone, to get the estradiol, to get the progesterone through a wonderful doctor and everything. and everything. So I started going back on it and maintaining it and microdose the testosterone, being on the lowest dose of estradiol, being on the lowest dose, well, not the lowest dose of progesterone, but the therapeutic dose of progesterone at 100 milligrams. And it's like my sleep is amazing. I've never had great skin, but my skin is great compared to what it had been, especially through menopause. I feel amazing. Do I have hot flashes? Occasionally. Yes, I do. They do. They fight through because hormones are never 100% balanced. Hormones are going to always do this and everything. So, it's, I'll have a hot flash. Alcohol will throw you into a hot flash. Different things, you know, we'll stress will throw you into a hot flash, and everything. So, but the thing is just finding that adequate dose to give me some sanity, to give me some balance. And it's different for everyone. Some women don't even go through menopause symptoms. Some people experience them earlier and than later, or vice versa. So it's been a crazy journey, but I've learned a lot. And because of what I've been through, it's what has sent me down that rabbit hole to study and learn everything I can. And that's why I want to be a menopause health coach now too. You know, a lot of people don't realize that menopause throws a lot of women into type 2 diabetes because of the metabolic state the body's in. So as a certified diabetes educator and a menopause health coach, let's prevent these things.
Well, and I think that you said a couple things that really stood out as far as just doctors treating symptoms. It's like, guys, you don't have to wait until there's symptoms. And if there are, let's, instead of putting a Band-Aid on it, get to the actual root cause. And one of my favorite things about being on calls with you is that you're never rushing anybody. You're always asking about their whole lifestyle. You're not just asking about, you know, what hurts. You're asking about what hurts. But you dig so much deeper than any other consult that I've been a witness to or had myself. And I love that part. But I also feel like I feel like the HRT stuff is turning into, or already has turned into, a lot of what health coaching is, that there's so much quantity and there's such low quality, and that it's not like you can just like slap the same medication on every person. It's just not how it works. A lot of what we do with Lane is, she's talking to clients like constantly, making sure that they feel well, talking about anything that might have come up, anything that might have changed. She works really closely with our doctor, Dr. Nolan, to make sure that everybody is really dialed in. And another thing that you said was that we always talk about this, that like hormones are like a moving target, that it's just, it's not like you can just, so if let's say that you do get the dose right on the first time, that doesn't mean that's going to be the same forever. Your body is always changing.
Yeah.
And if something, and that's even like when people come that they're like, well, this diet worked for me in the past and it's not working now. Well, like, you're not the same, like we change by the minute. And so it's really important to make sure, whether you're working with a health coach or working with a registered nurse or whoever you're using as your village and your team, that you're always communicating, because things are always going to change. And I think that's so cool about the way that you do things, is that you're always tuning in, and that, you know, you're not comparing somebody to who they were, but on the last, well, you're comparing it, but you're not using your advice or that you're giving based off of your last consult call. You're like, hey, let's see what's happening. Let's see what changed.
Absolutely. Absolutely. And it's important. It is important to have that comparison. I wish I had labs from when I first went on this journey. I wish that gynecologist had done labs for me so I could see where I was then, and then where I was at my lowest, and then now where I am, where I feel great. And it's just a little boost. My numbers aren't high, they're just therapeutic, and that it makes a difference. It really does.
Well, I've had several people come to me that say, I missed the boat. I'm too old for HRT. I can't do it. And I'll tell you, well, I won't tell you what my answer is. I'll let you answer that.
Well, and that was a question. There was a question. I think it was I'll answer that when I get to it. But it's um, it, we're never too old, because if you're having the symptoms, all you're doing with the replacements is you're not covering those symptoms. You're replacing what your body naturally makes. And when you're replacing something your body naturally makes that is no longer there or adequate or working like it needs to, all you're doing is giving those numbers a little boost. And
Mhm.
every function in our body, every function is dictated by hormones and molecules and nutrients, micro, macro, everything has a role. And so hormone replacement therapy is just replacing what your body's lost. And so if you are having symptoms, when we think about how many older women are walking around humped over and at risk of bone fracture. My background's orthopedics. Do you want to know how many women I took care of in the hospital because of hip fractures?
Yeah.
And those were from never being managed properly during menopause. Once they lost all those hormones, they lost the ability for the bones to stay dense. And
Mm.
there's other factors
This
that happen there too. We can, which is another topic. But it's just important. So I don't think that there should be an age cap on having a little bit of replacement to help you get through any of the unwanted symptoms you may be having.
Mhm.
is this the same for men as well?
Yes. I mean, you know, and men right now we're seeing, and there's a study that was done. Our young guys have less testosterone in them now than 70-year-olds had back in the 80s, or vice versa. 80-year-olds had back in the 70s, whichever one it was. But the point is, our environment is also destroying our hormones. Our
What would be the cause of that? Like low testosterone at young
it,
ages.
processed foods, is it cell phones? We don't, environmental things that are causing inflammation in the body, and interrupting those hormone loops. And when those hormone loops can't communicate and there's a disruption, it's hard.
So I know we kind of went on a tangent. It's hard not to talk about hormones, like with just what we do, because it's all connected. Even though our goal is to well, we have a lot of hormone questions, but we have a lot of GLP-1 conversation questions that came in. Thank you to everybody who submitted a question for the pod.
Yes.
And I think that there is a lot of myth busting that needs to be done. And first of all, I think we forgot your disclaimer. Why don't you do your disclaimer, and then we'll jump into GLP-1s?
Yes, definitely want to do my disclaimer. Just do you know that I am a registered nurse, certified diabetes educator. I am not a doctor. Anything that I share with you is not medical advice. This is strictly for education purposes. It's not to override anything your doctor might say, or uh, you know, I'm not affiliated. I'm going to share a couple of names of some books that are great books. Not affiliated with any of these folks. Not getting paid by any of them. So just want to make sure that you're aware of that.
I'm glad that you added that not getting paid by at the end. fucking social media and the bullshit that's out there is just unbelievable. The things that are being peddled.
It's crazy. Yeah. And I there's some books that I get a lot of my information from, but I'm not selling any of them or anything like that. I'm not getting paid by any of them. But, if people want evidence, then I always suggest go do your own research.
Mhm.
If a doctor tells you you've got to have major surgery on something, are you just going to go by his word, or are you going to go research it?
It's like when Sarah's reading, I'm like, what are you reading? She's like, oh, there's a 400-page book on menopause. I'm like, oh, yeah, that sounds good.
Yeah.
Brushing up on cholesterol.
It's so interesting though, 'cause when you talk to people, it's all real stuff. And so it's interesting to learn all this stuff.
Mhm. And again, it's not like anybody tells you any of these things. And also I feel like for like, well, I think it's probably crossover too, that everybody just assumes that when it comes to like this whole healthy lifestyle, that you're just supposed to know what to do, that you're just supposed to innately like have this ability to take care of yourself. But all of these things are learned skills. And so it's so important to have people that are on your team. It's really helpful if they've gone through it themselves. I know that it's nice when you have somebody to relate to. My coach is a like hardcore bodybuilder guy, and I did just fine. But as far as just like having that empathy and that, it's just a totally different vibe when you have somebody that has been through and walked the path that you want to walk. So I think that's such an important thing. And what's so cool is that Lane joined the team as a client a couple of months ago and is getting a taste of, actually she's not getting a taste of, she jumped in with 2 feet to the Fit With Me lifestyle. And it's so cool to see like kind of with our forces combined how amazing the progress is. And Lane is looking awesome. I know we're not supposed to talk about that stuff about a nurse, but she's looking good.
Well, thank you. Because menopause was not kind to my body at all. And then I was laid up with the bad hip. And then that was 3 years ago, September. And I'm like back to backpacking, which is my love and my passion. And everything. I'm back to backpacking. I, am able to do my activity. I just have to listen to my body and make sure I don't push it further than what the hip. If the hip's telling me, whoa, hold on, back off, I listen to it. But otherwise, it's been amazing.
Well, Mark's gone full throttle with Fit With Me lifestyle.
Yeah.
And it is freaking, I'll let you talk about it. Go ahead.
It's probably like about a year ago. Renee, my mother-in-law, she started writing plans. Because I've always worked out, and I work out, 5-6 days a week. But like I wasn't pushing myself. I was just kind of just willy-nilly do my own workouts. And then Renee started writing plans for me, so I have like the Kahunas app, and I can sort of write what I lifted the week before and like goals for this week. And so I started tracking her workouts, and she wrote all the plans for me. And I never used to work out legs. And Sarah's, you gotta work out legs. You gotta work out legs. I was like, oh, I hate doing legs. It sucks and all, whatever. And so started working out legs, started doing the plan. And like over the last year, I noticed like crazy amounts of changes. We were just talking earlier how I don't want to look at scale because my weight's actually going up, even though I am, because of gaining muscle. So even though I'm getting smaller and I guess it's less fat, not smaller, muscular, the scale, it messes me up a lot because I'm like, oh, I'm off like 5 pounds, but then I look at my body and I'm like, oh shit, I'm like, shit. So I've been on a fit plan for a while, and it's doing drastic changes to the body.
I have like the worst news for everybody that's listening. It's bad news for me too. Mark stopped drinking like probably almost 3 months ago. And it is bananas how much it accelerated his progress. Like he's been making steady progress, but I mean, we eat pretty well. We've definitely dialed in our nutrition these past couple months too. So it's not just the booze, but he would only drink once a week. It's not like he was, and then he might have like a less nutritious hangover meal, but just making that one adjustment, it is insane how much leaner and how much more anabolic he is. It's crazy to see.
Like I'll have an occasional drink at dinner, like maybe like espresso or something. I don't like, but yeah.
Maybe I'll get there.
I feel so much better. Just overall, there's no hangover days. Just mental clarity. Because a lot of times you work hard during the week and then you drink like Thursday, Friday, whatever, and then like you're spending a day or two, or 2 days more, and not really doing much activity, and then you're like starting backwards as opposed to not drinking. I'm just charging forward all the time. Even Saturday I'm at the gym, Sunday I'm at the gym. Good. Just it's all around.
I'll get there one day. Our apologies. We just had a little technical issue. And for a second, we thought we lost the entire first part of this recording. So we're back. And I'm pretty sure I was just rambling about how you can't just take a GLP-1 medication, that you have to make lifestyle changes. And I'll let Lane elaborate on that as well.
Yes, so I definitely support that. Again, these GLP-1s were designed originally for persons with type 2 diabetes to manage that disease. The positive thing that they found from them is they also provide weight loss. So, but with this weight loss, you've got to still do the mindful eating, the increased activity level, water, hydration. These medications can cause dehydration. And if you're not staying hydrated, you run the risk of having kidney issues from them. So again, we were speaking about side effects, unwanted side effects and things. And you mentioned people who end up sick from them or in the hospital from them are typically because they're not following the rules. And I agree with that 100%. If you're not staying hydrated, you run the risk of kidney disease, or kidney damage. I shouldn't say disease, but damage, and everything. One of the other things that's important to know is in the studies, when they started looking at the weight loss effect of these drugs start working within the first 4 to 5 weeks. They're built up in your system and they're working. However, for the weight loss to start really occurring, they're seeing it at 30 weeks, which is 7.5 months. That's not overnight. And then they're really seeing that improved fat mass and lean mass at 52 weeks, which we all know 52 weeks is a year. So, it's not after 1 week, when people say, I'm not seeing a difference, I'm not feeling a difference. Okay, give it a little time.
Well, we talk about time a lot on this podcast because it is the hardest part.
It is.
I find like with clients that so I think the best and the worst part about the medication is the appetite suppression, and the food noise going away. I think that's it's the best part, but it's the worst part because you don't have that. You don't want to eat. And then you think, okay, well now I can like really control my caloric intake and I can really, really undereat and really make this happen faster. I've seen that doesn't work, and that the people that totally stop eating or eat very little, that they don't have any better results. I see that they actually have slower results, and that the people that are feeding their bodies, and yes, you can go into more of a deficit because you're more likely to stick with it than if you don't. And then if you have the food noise and you have the hunger and you go into more of a severe deficit, you're more likely to go back the other way and binge. But that's the same thing with weight loss surgery. Weight loss surgery kind of forces that compliance for long enough for you to see results, and then you're motivated and all of that stuff. But I do find that the people that are just like, I'm not hungry, so I'm not eating, that they don't have as good of results. Have you seen that too?
Yes. And keep in mind too, a lot of my background with this medication was my initial with it was in an endocrinology office where I could physically lay eyes on the clients. I could physically sit there and say, okay, well, tell me what you're doing, and everything. After I've sent them home with meal plans, after I've sent them home with eating right and everything. And so many folks don't even consume 3 meals a day. And so, but they think that the junk that they're eating at various times isn't part of meals. But when you start adding those calories up, if you would just remove that junk and make it an extra meal in the day, an extra healthy meal, which y'all had to teach me to do. When y'all told me I had to do 4 to 6 meals a day, I was like, what? I barely get 3 in. But it makes a difference. And with these GLP-1s, because if they do take that hunger away, it should be easier, but I can't say that it is, but it should be easier for people to consume more smaller meals. I don't need to get 800 calories in one meal. I can do 250 and 250 and 250. And therefore you should see better results with it when you're eating like that.
Yeah. And I think that it always goes back to that food quality too. If you're
Mhm.
eating a lot of processed things, if you're not having lots of colorful foods in your diet, then you're probably going to have more digestive symptoms or side effects, I should say. And I'll let you speak on this, but I find that the most common side effects that I see in clients is going to be nausea at first as your body's
Mhm.
adjusting to the medication. And then
Yep.
constipation is something that I'm always watching for and always saying, hey, communicate with me if that's going on, so that we can make sure that we can adjust your diet, make sure that you're going to the bathroom, because some people don't know that it is very important to poop every day.
Yeah. Yeah. I watched the show Alone. More people go home on that show because they're not pooping. Naked
Yeah.
and
Oh yeah,
Afraid.
too.
We love that
Naked,
show.
naked and
Named our dog
Afraid. They
after
go
Alone.
home because they're not pooping.
Yep. Yeah. We actually, Mark was just saying, go ahead.
We named our dog Bear after Alone because when we were watching that show, they always go, "Hey Bear, hey Bear." So Sarah and I would always be like, "Hey Bear," just like yelling at each other, not yelling, but, like joking around. And so we said, look, he just ran in the room right when I said,
He knows his
we
name.
kept saying, "Hey Bear" all the time. And then we said, next time we get another animal, we're gonna name it Bear. And that was 3 years ago, and he just turned 3 years old.
Oh, I love it. That's a great story. I love it. But I mean, that just goes to show you that eating the wrong things and not going to the bathroom causes a lot of issues. And
Mhm.
with the GLP-1s, we have to remember, again, hydration, hydration, hydration. Water is so vitally important to keep our intestines, our motility, to keep things flush, to keep, I don't want to say liquid. What's the word I'm looking for? To, um, to bring water in.
I always call it digestive lube.
There you go. Digestive lube. There you go. Perfect. That is perfect. And then fiber, because what happens is if it's taking the food noise away, you're probably not going for your more fibrous foods when you do
Mhm.
eat. And so you want to make sure you're getting those fibrous foods. Okra is my favorite. I can eat some okra and clean out.
You just showed your South there, girlfriend. I don't think I've ever had okra. I don't know if I've ever even seen it.
I had it once, and I didn't like it. It was fried okra when I tried it.
I'm in the South.
I know.
Pickled okra, fried okra, boiled
Ooh,
okra. There you go.
pickled. I like pickled things. Pickled stuff's good for your digestion too.
Yeah, there you
Okay, so
go.
before we jump into questions, were there any
Okay.
other side effects that you see more often aside from the nausea and the constipation that we see, and sometimes diarrhea? I see that sometimes too.
Well, and one of our questions was about the side effects. So,
All right,
who
so
had
let's wait.
that?
Let me pull
Yeah,
up the
because
questions
Yeah,
here.
I see it right there.
Oh, here we
yeah,
go. Coming from
because
Jane, less common side effects of GLP-1
there,
meds.
there you
The-
are. There you go.
we can piece
Okay.
out.
Yes.
Let's piece out the questions so that we make sure that we hit them all. So let's start with Jane's first question: less common side effects of GLP-1 meds.
Okay. And guys, I did take notes because there's no way for me to remember every single thing
Of course you did.
on two different topics. And so,
Lane's
I
the
did
most
my whole.
prepared person of all time. Like literally, if I ever like challenge her or question anything, she'll send me like a whole study and she'll be like, "This is why I said that." She's so good about that.
So let's talk about side effects, because one of the things you're going to see in the headlines right now is, and big disclaimer here, study titles are very misleading and majority of people won't read the whole study. And so they'll read the title and go, oh gosh, semaglutide's causing blindness. Okay, semaglutide's not causing blindness. What it is if you do have diabetes and you are at risk of diabetic retinopathy, then semaglutide does seem to be tipping that iceberg. So it's something to really be concerned with if you do have diabetes and are at risk of diabetic retinopathy. So I want to put that out there. There are some, studies that are showing that there can be a risk factor with it. Everything has a risk factor. Everything. When doctors prescribe stuff, they'll say, well, the benefits outweigh the risk. And everything. So common side effects: nausea, constipation, loose stools, changes in your digestion, appetite, dehydration. Less known or less seen can be things like Did people know that it's actually lowering blood pressure? So guess what? If you're starting to have these like woozy episodes, or you go to stand up and you feel like you're going to pass out, what is your blood pressure doing on this medication? Are you on blood pressure medication already, and now you're losing weight, you're eating healthy, you're exercising, and you're on a GLP-1? Are we making you hypotension? These are important things to know. Also, aversion to alcohol. I was mentioning that earlier. Aversion to alcohol is one of the things that is really actually a positive side effect that people are having from it. Things that are most dangerous that we do want to watch, and as pancreatitis, anything that's affecting your pancreas, anything that's telling your pancreas to stimulate and make more insulin. We do want to, watch out for that. So severe abdominal pain would warrant stopping the medication and seeking medical attention. We don't ever want to put anybody who has a history of thyroid cancer on this medication, because it is linked to medullary thyroid cancer, I think is the correct one, that it has been linked to. If you have a history of it, you want to avoid it.
Okay.
Doesn't mean it's causing it, but it's something to definitely watch for. And then I just mentioned the newer one, the diabetic retinopathy, is something that they're really, they're watching for.
The people that experience some like exhaustion, is that just from not eating enough, or is that from something that's going on with blood sugar? Because every once in a while I have somebody that will start and then they'll say, hey, I'm like feeling really tired.
I can't say for sure that that's what it is, but definitely if we're not taking in enough calories, we're going to feel weak. We're going to feel tired, fatigued, and everything. Now, I mean, and not to go back on me, but now that I'm doing 4 to 6 meals a day, if I miss one now, I start getting shaky. I start getting fatigued. My body is like, okay, you need to go eat. And so maybe on a GLP-1, if it's shutting down that food noise and not really making you feel hungry, you're not associating that tiredness with the fact that you need to put some gas in the tank.
Okay, that makes sense.
I can't say it enough to people. Food is gasoline for your body. It's gasoline for your body. If you don't eat, there's no fuel, the low fuel light's on, you're going to run, you're going to tank.
Well, the whole diet industry just tells us to eat less and move more. So, that's the guidance that we're giving. And then it turns into, I know for me, for a long time, it turned into a game of how little can I eat?
Yeah. Yeah.
And that's how I fucked up my metabolism.
Yeah. I feel so much better eating multiple meals a day.
It's wild, right?
I feel so much better making
How
myself
much
eat.
can I eat?
Yeah, Mark is like a contest eater. It's incredible. He should have a collection of T-shirts for the amount he eats sometimes.
Show me a buffet with some Korean barbecue. I'm sitting there for a while.
I love it. So Jane also.
Go ahead.
Yeah, go ahead.
Second part to Jane's question. Yeah, come on, Lane. I'm the host here.
Sorry.
No, I'm just fucking with you. The second part to Jane's question was also the effectiveness of a higher dosage over a longer duration. 2 to 3. I feel like you and I were just talking about this.
Yeah. So here's the big thing. We know that microdosing, we're able to avoid those unwanted side effects. And so we also know, well, y'all may not know this, but from the studies, anything over 4 milligrams, is it still recording? Anything over the 4 milligrams is also not advised, because that they're showing that as actually being the dose that will make people sick and everything. So clinical studies are showing that 0.8 to 1.6 milligrams have very therapeutic outcomes for semaglutide. The key is with this medication is the half-life of it is 7 days. That's why it's prescribed as a once a week injection. I know that we microdose with the vials, the compounding vials. We don't microdose, but our doctor microdoses at the twice a week taking that whole dose and splitting it into two. It may be, though, for some people, they will respond better just with one once a week. That's why communication is so important, because this medication does stay in the body it's got a short metabolite to it. It metabolizes quick, but it stays in the body for 7 days. And then it takes 4 to 5 weeks for it to actually achieve a steady state at consistent levels. So that's why typically we want to put you on a dose. If we are going to start you out at 10 units, we want you to run that 2 to 4 weeks, but really preferably that 4 weeks. We start you at a really low dose to see how your body is going to react to it and everything. But it may be that you're going to benefit more by staying at a dose for 4 weeks before you increase to the next dose, before you increase to the 20 units or so forth and so on, so that the body has time to really get that steady state at those new doses. And everything. And this is why adjustments are just, so they're needed. But we also, everyone varies. Some will need adjustments sooner. Some will need adjustments later. The more we know, the more we can really help to tie in those doses for each individual. We can work with, the doctor or the pharmacy, whoever, we can help to troubleshoot any issues if we're not seeing progress, or if we're having too many unwanted side effects. It might not we need to stop the medication. It just might mean that the body doesn't need as much, and everything. So there's just so many ongoing studies too with semaglutide and tirzepatide, because they are still relatively new. Yeah, we're looking at, them being around for a minute, but they're learning more and more. To really study something, you've got to study a group of people for a long period of time to really truly find what those outcomes are going to be, and everything. So, that's probably my biggest thing. Hopefully I answered that question.
I don't hate pushing it a little bit for more of a deficit phase, just to help with adherence. And then dialing it back. And then if I'm doing like if I'm feeding up and really trying to push calories up a little bit, if we're taking a break in between diets, I'll back down and let a little hunger come in. Obviously this depends on the person, depends on where their insulin and their blood glucose and everything are. But I don't hate manipulating it and tinkering with it a little bit. You haven't yelled at me about doing it, so.
Well, and again, because we've got to find what works for you is not going to work for the next person or the next person. We've got to find, everybody is individualized. No two people should be treated the same exact way, because everything about two people is different. And so that's why communication. I know you and I are big about telling anybody we talk to, communicate. Please reach out. If you have any questions, please reach out, communicate, because we can't fix it if we don't know it's broken.
Oh, I like that. I'm going to use that. Want to do the next one? Yeah, Elisa.
So this question is from Elisa. What are the benefits of compounded GLP-1 versus name brand medication, or is it just a matter of which is cheaper for the individual?
So its simple answer is availability, because Ozempic, Wegovy, Mounjaro have all become so popular, the pharmaceutical industry can't keep up with the demand. So people go to, they get this prescription, and then the drugstore, the pharmacy says, sorry, we don't have it. We don't know when we're getting it back in. So that can be frustrating, because you're taking something and then now all of a sudden it's not available. Compounding is being mixed. It's literally the compound is being mixed with the sterile water, the carrier, right before they ship it out of the compounding pharmacy. So you've got this nice fresh, vial of freshly mixed. you've got 5 mLs of it, which is 500 units of it, versus a pen that is a 1 or 2 dose and done. And so with your name brands, the pens are very expensive. If your insurance isn't covering them, you're looking at $400 a month. If I can get a vial that's going to last me 4 to 6 months for $500 to $750, depending on the strength, the pharmacy, what compounding pharmacy, whatever. And those are just some estimated quotes, and everything. But if that's going to last me 4 to 6 months versus me paying $400 a month for the pens, and there's a chance those pens aren't going to be available, then that's the biggest difference. Now, if insurance will cover it, then obviously cost effective wise. But if insurance is covering pens and your pharmacy can't get them, and I spent a lot of time at the endocrinology office chasing GLP-1s because nobody had them and people were freaking out. And I had pharmacists telling me, we don't know when we're going to get them in. We don't know, and everything. So people were, and I'm not saying people I know personally, but people were turning to other countries to get them, only to find out the pens they were getting were full of nothing but saline. So you have to be careful.
That was exactly something that I wanted to bring up in reference to this question, is be really careful where you're getting these medications, because there are tons of counterfeit everywhere. And like these little clinics that pop up all over your neighborhood, there a lot of them are not legit.
Yep. It's very, very scary. And the biggest thing about the vial, we can microdose it. We can taper your dose back down if you're having an adverse side effect to that larger dose. We can bump you up. We can ramp you up. We have that ability to make adjustments based on your needs.
Yeah.
Which
I think that being able to adjust it is a big pro. And you can do like those little incremental adjustments. It doesn't have to be like from one pen to the next.
So one pen contains one full dose.
They're all different, like strengths.
Okay. And it's a dial. You have to dial it. Let me see. So, Ozempic.
Look at you just whipping out Ozempic pens.
You have to actually dial the dose, and then once you give the dose, you're done. And there's no, this one doesn't have the ability to let me dial it. Okay, this one does. I don't know if y'all can, where's my camera? I don't know if you can see this. All right.
I can see it.
So when you dial it, you have dot, 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 dot until you get to your milligrams. All right, like this pen, I just dialed it a bunch to get to 1. So when I push this into me, I'm going to push fluid. Now this is a multi-use pen. It's a 1 milligram. So every week, I'm going to dial it to 1 until it's all gone. And I think it's going to give me 4 uses. No, actually this is a 1 milligram. So it's going to push all that fluid into me one time, and then I'm done.
For anybody that's listening and not watching, Lane just whipped out like a basket of Ozempic pens. It's like I don't know what kind of backyard drug selling operation she has. She's a diabetes educator, guys. Remember, there's a reason why she has those laying around.
They're demo pens. The joy of being a diabetes educator is your pharmaceutical reps will give you demos. So
Did you see that South Park episode about Ozempic? Because if you haven't watched it, even if you don't watch that show, you should watch it. You will die laughing.
I need to. So this is Mounjaro. So with Mounjaro, you literally unlock it, press it against the skin, and this isn't where you would do it. You would do it in, obviously, subcutaneous fat. But you press it against the skin, you push the button, and it delivers the medication. And then, so again, now this goes in the garbage. So so the vials just give you, and when the pen malfunctions, guess what? You've got a pen full of medication that you can't even inject because now it's malfunctioned. You got to go back to the pharmacy, get them to trade it out, get your money back. So a vial just gives you a little more freedom. In my opinion, if you can afford to pay for it, it gives
Yeah.
you a little more freedom.
Yeah. I agree with that as well. So the next question, it's so funny. I like read the next question and I was like, do I want to say her name? And I was like, she posted her name. So Jessica Valoy, who, by the way, guys, she's going to be on the podcast next week. So her whole family has been sick. So that's why she's been missing.
Bless her
She
heart.
asked, can you talk about GLP-1 medications and family planning? How long should someone be off a GLP-1 before trying to get pregnant?
So keep in mind, it's at a steady state in your body for 4 to 5 weeks. So Ozempic, and I didn't Google anybody else and anything. And be careful with Google, people. Know what you're Googling. As a healthcare provider, I can go into healthcare links to get my information and everything. But Ozempic does recommend stopping it 2 months before planning to conceive. However, there was a big study done. You know me and my studies. They followed 50,000 women from 6 different countries who were on the GLP-1s early in pregnancy. And, like maybe got pregnant, didn't realize, and everything. So they, of course, had them stop it, and everything. They didn't have them continue it through the whole pregnancy. But what they did do was when the babies were born, they followed the babies for 1 year, and out of the 50,000, there were no birth defects. So this is promising, and everything, but it's just not studied enough and not approved to use in pregnancy. So if you know you're going to plan, give your body a washout for 2 months. Don't take that chance.
Mm-hmm. Well, and I think this might be a question. So hold on. I should probably look. No, maybe it is. Maybe it's not. Oh yeah, it is a question. We're going to leave that alone. You want to do next one?
Yep. Next question is from Samantha. If semaglutide stops being as effective, can you change to tirzepatide? Also, the same question about how long to be on it, how to wean off it, or should you stay on as a maintenance dose forever? What are the cons of being on it long term?
Okay. So both are great. I think I kind of covered it when I was talking about the two and how they work the same but work a little different. And some people are just sensitive to one or the other. And by all means, I believe we were discussing earlier before we had technical difficulties. If you're not responding to one, it's okay to try the other. If you see, again, we've got to have that time to see how you're responding. You might not see weight loss coming off, but what is your A1C doing? How are you metabolically responding to it? Because if it's bringing that insulin resistance down, if it's helping your body to utilize the blood sugars, the blood glucose more effectively, then you really are getting benefit from it. You just might not be getting the weight loss benefit from it.
And are you doing the other stuff? Are you on your nutrition plan consistently? Are you getting your training and your cardio in? Are you drinking your water? I think before people start, because I think a lot of times people just want to like jump around medications. And I think that it's important. And I've been guilty of this with various things. With my fucking 20 years of dieting, that I would be like, oh, this isn't working when I hadn't like really, locked down all of the things. So I think that it's important to look at all of those things. But, like we said before, I think some people do better on one than the other. But I haven't found, and you can tell me if what you've seen, I haven't found that somebody like, I think I don't really think I've seen people like plateau on one or the other. Maybe a dose needs to be adjusted, but it seems like if one works, it probably works pretty well. And I'm trying to think if there's been like a situation where that has not been true, but I'll let you speak on that as well.
I know that, and I will not mention any names because I will not violate HIPAA, but I know you and I spoke to someone very recently and they wanted to go back to semaglutide. They started at semaglutide. They got switched to tirzepatide. They saw better benefits on semaglutide and they wanted to go back to it. And taking that break from the semaglutide and going to the tirzepatide, they may go back to the semaglutide and just like boost, like
Ooh, that's
skyrocket,
interesting.
because now they've gotten their body kind of tweaked. And that's another thing,
Hmm.
to answer the, like the long-term cons of being on these is they're hormones. Remember, these are hormones. These are amino acid peptides that have a job to do. And it's just like with HRT and TRT. The longer you're on something, the more lazy your body will become. And it will feel like it doesn't need to do it naturally because
Hmm.
it's got that boost in there doing it for it. And the GLP-1s are that boost. They're that they're the boosters on the rocket. And once those boosters fall off, and I think I get into this more with the weaning off of it and everything, but when those boosters fall off the rocket and you're out in space, you're still, the rocket's still able to cruise and do its job. It's just not got that boost behind it. This is the
Hmm.
boost. And when you remove it, you don't have that boost anymore, but you're hoping that the body is doing what it's supposed to do on its own.
Hmm. And on that note, it's not recommended to just be like popping on and off, and you know,
Mm-mm.
and I'll make sure that everybody knows that if you just decide to take yourself off this stuff, which is going to go into our next question, that you do have a really high chance of rebounding if you don't do it properly, and that you're going to be fucking hungry really, really
Yeah.
fast.
Yeah. They were designed to be long term because they were designed to treat people with type 2 diabetes. They were not
Mhm.
designed to take for 6 months and come off. So keep that in mind too.
Mhm. Um, we got so that I did just kind of spoiler alert on the next question, but Elisa also said when and how to wean off GLP-1 medications, or is it okay to stay on a low dose
Okay.
for A1C control?
All right. So any drug that alters your body response system can create a state of internal imbalance. So you can have some withdrawal symptoms. But when we're talking withdrawal symptoms, we're not talking like an alcoholic going through withdrawals. We're talking about, again, that rocket had that boost. It had boosted things to kind of pick up, to kind of quit being lazy. Do what you need to do. Do what you were designed to do. We're going to boost you. But if your body goes back to being lazy again off of it, you can have a little bit of that, the habits, like the habits. You've got to make sure you're doing the correct habits. Very important.
Mhm.
So again, GLP-1s imitate what the body's natural hormone GLP-1 is supposed to be doing, which is involved in many functions. It's cardiovascular protective. It's blood glucose regulation. It's insulin secretion. It's nutrient absorption. It's neurological brain pathways that signal hunger and fullness. So when these external GLPs come in and they boost all that internal stuff, great. But when you stop that boost, you may have a little rebound effect that increases your appetite or decreases that fullness feeling. You may have an increase in blood pressure. You may gain weight. They typically don't see that weight gain within the first year of coming off of it though. And it's usually gonna be your bad habits coming back. If you created the good habits with it, you're gonna pretty much be able to stay and maintain. For the A1C benefits, it may be more effective to go from that twice a week dose to the once a week dose because you're just trying to maintain that A1C.
Right.
You might not need to do 2 shots a week. You may just need to do 1, and everything. Again, we want to see how it's working in the body for you. And again, this is why lifestyle changes are so vital when you're using this medication. You've got to form the good habits that will last and decrease those rebound possibilities. There's going to be that re-regulation phase. When you remove something, body's got to re-regulate. Body's got to go, oh, what do I do now? And everything. And again, it was about a year after coming off of it, in some of the studies that people did see some weight gain, and everything. But again, they likely were not making the right choices with it.
Yeah.
And again, it's intended for long-term use. It wasn't intended for weight loss.
Mm-hmm.
If you want to come off of it, big thing. If you want to come off of it, have a game plan. Don't reach out to Sarah and say, I stopped it.
Oh my
Reach
gosh,
out to
please
Sarah and
don't.
say,
I've had that happen before, and it's like, girl.
reach out to Sarah and say, I want to stop it. What do I need to do? Okay. We want to start decreasing the dose and see how you're responding at those lower doses. We don't want to abruptly stop it. That's like the rocket booster quitting halfway up in the air and the rocket's going to crash.
Mm-hmm.
You don't want that to happen. So definitely reach out, have a plan. Reach out to your healthcare team and have a plan.
That's perfect. Yeah. There is definitely, just like there's an art to using them. Once you're ready to be done using them, there is definitely an art to coming off so you can maintain your results. And that's the goal. So definitely don't rush it is what my advice would be on that.
No.
Is there, I think we could wrap it here. I think that we covered most of the GLP-1s. We're going to do another pod to talk about menopause, HRT, those types of things. I think that it can have its own pod. Plus we could talk about, we would end up making a 5-hour podcast, which is basically what Lane and I do on consult calls.
Yeah.
Do you have anything to add to, before we wrap this up?
No, if anybody still has concerns about GLP-1, one of the doctors that I follow, and I'm not promoting anybody again, it's just knowledge is the best thing we can do for our own health and everything. But Dr. Tina Moore, but she spells it Tyna Moore. She's got some great data out there on the GLP-1. She really shares some really good and everything. And then some of the newer studies are coming out and really showing how it's regenerating heart, kidney, and pancreas tissue and everything. So they're finding it just, being more and more safe. So hopefully that answers some of people's concerns as far as safety and efficacy.
Oh, for sure you did. But I think in a nutshell, we can basically say that we have no problem with these medications if they're used properly, if they're used in combination with proper nutrition, hydration, movement, all of those things, that they do definitely work, but they're not going to do all the work. So if you're looking for long-term results, if you're looking not to have side effects, those types of things, make sure you're getting it from a good source. Make sure that you have somebody that is going to monitor you and help you. Don't just walk into one of these random places in your neighborhood. We have resources and we can help anybody, but we can also point you in the right direction if you're looking for somebody to help you with the GLP-1 medications or anything else that falls under the wheelhouse of HRT and those things that we'll talk about later as well. All right. Well, apart from our technical difficulties, this was super fun. Thank you for coming on, Lane. I really appreciate it.
I appreciate y'all. I'm technically challenged.
I'm not great either. Without Jess, oh my God.
And Mark, it was great to meet you.
as well.
Before we wrap up, I should probably say that Lane is offering consults. If anybody wants to talk hormones, GLP, and metabolic issues, she is available. If you go to teamfitwithme.com and you go under a la carte services, health and wellness with me, there's a whole little how it works button to explain how everything works. We're happy to jump on a call with you together and make sure that we get you all the way hooked up. Just check out the website. If you want to get in touch with Lane directly, you can email her at lanef@teamfitwithme.com. Thank you for listening to the Been There Lost Fat podcast. Our motto here is do it right so you only have to do it once. If you're looking for personalized and customized programming to reach and sustain your health and fitness goals, check us out at teamfitwithme.com. Complete the info form and then we can set up a consult call. Thanks, Lane.
Great. Thank you. All right. Bye.